Chronic pain affects approximately 20% of the global population. That's over 1.5 billion people. And as we'll discuss today, conventional therapies aren't exactly cutting it, and there's a growing interest in how psychedelics could help change neural pathways involved in pain and hopefully improve outcomes. I'm Elena, and this is the integration session where we explore the science, stories, and future of psychedelics. My guest today is Dr. Sinziana Pop, a neuroscientist with an interesting career trajectory who is very passionate about uncovering the therapeutic potential of psychedelics for chronic pain, particularly for women. We're going to discuss why and how psychedelics could help people with chronic pain and the future research that she has planned to help advance this line of work. Let's get into it. Hello, Cindy, and welcome to the Integration Session podcast. Thank you so much for being here today.
Thank you. I'm so glad to be here.
Awesome. Yeah, so I want to jump right in and just talk a little bit about your professional trajectory to this point, because I know you've had an interesting path through a few different fields. So, how did you become interested in psychedelics and psychedelics for chronic pain?
I'm an evolutionary neuroscientist, and I've been studying questions such as how brains evolve using fruit flies as model organisms and doing research for enhancing knowledge for knowledge's sake, which has been quite rewarding and quite fun. However, I have been living with chronic pain for 10 years, and I've been interested in alternative therapies for chronic pain for myself. And finally, I gathered the courage to shift gears and make this my main research.
That's so interesting. So, what prompted specifically your interest in psychedelics for chronic pain? Was there insights from your basic neuroscience knowledge that sort of pushed you in that direction?
So I think insights from my personal experience, but also from the neuroscientific understanding of how the brain functions. So I was actually going through a difficult time, and my PhD mentor, Darren Williams from King's College, he sent me a lecture on predictive coding and how the brain updates its model of the world by comparing predictions about upcoming signals with actual signals. And I think it finally clicked then that my anxiety, my stress is impacting on my chronic pain, which can be explained through this neuroscientific theory. And at the same time, I was also exploring ideas of altered states of consciousness. And I figured that if psychedelics can do that, and they can also influence mood disorders, then they might actually be the treatment we need for chronic pain.
Hmm. And how do conventional treatments fall short? Is there really a need for these new and novel interventions for chronic pain?
Um, so pain, I think many people can think of pain as the result of an outside stimulus. So we get an injury, that signal travels to the brain and we feel pain. However, this is not at all how we understand pain anymore. We understand it as a product of the brain. And it's an experience produced by the brain to perceived threat. So our perception matters. The psychological state we are in and the social context we are in matters in terms of how we feel pain. This model that explains pain is called the biopsychosocial model. So it takes into account all of these facets of pain. So to treat pain, we would need something that acts through these biopsychosocial model. And psychedelics do just that. They act on neurological mechanisms. So they act on serotonin receptors, among others, also on functional networks in the brain. So that's for the biology side of things. But they also act on how we perceive the world, on our mood. Also, they create openness to others and to the surrounding world.
Yeah, it's interesting. I actually have a little bit of research experience with fibromyalgia and neuroimaging of those regions in the brain and the brainstem that are involved in pain. So we imaged what are called like the descending modulation of pain, which is
Mhm.
these regions that inhibit upcoming pain signals. So in chronic pain, are those sort of altered in a way? And do psychedelics act on those regions to help modulate pain? Or how exactly do psychedelics sort of overlap with the chronic pain neurobiology?
So, the brain regions and functional networks that are involved in chronic pain, but also depression and anxiety, they overlap. It's important to mention that the changes that people have found in these brain regions are not exactly the same. So, for example, in one condition, a certain brain region can be enlarged, whilst in another condition, that brain region is shrunken. But the overall outcome can be the same. So, for example, in all of these conditions, the default mode network is overactive. So, this is the functional network in the brain that is active during introspection, so self referential thoughts. It's been called the daydreamer. And this is exactly one of the networks that is targeted by psychedelics, and it's quieted down during the psychedelic experience. Uh, this is just one of the networks. There are also other brain regions and other networks on which are in common between the conditions and which psychedelics act upon.
Interesting. And are there already trials testing psychedelics for chronic pain? And what are those outcomes like so far?
Yeah, so I think there's now an explosion of psychedelic clinical trials being proposed, and open for recruitment. Most of the results so far are on mood disorders, but there is preliminary data and pilot studies on, for example, fibromyalgia, like you mentioned, or phantom limb pain that are showing really promising results. What I find really interesting is that psychedelics have been considered for the treatment of chronic pain 100 years ago. One of the first papers is on treating phantom limb pain using mescaline in 1930, with a few more to follow in the 60s and 70s for treating cancer pain, fibromyalgia, migraines. Um,
Interesting. And is it psychedelic specific? So are there certain psychedelics that show more promise? For example, ketamine. I know there's some interest in collaborators with the Center for Psychedelics Health and Research here. Dr. Tim Solomons here is doing some work with ketamine and mindfulness-based therapy for people with chronic pain. So, which psychedelics show the most potential in your view? And which therapeutic model, if you know of the evidence yet for that.
so I don't think we have enough evidence yet for which psychedelic compound is best suited. But I think what is becoming clear is that including therapy is absolutely a must to ensure a positive outcome. In fact, in these recent studies, um, psychedelics act on pain interference and increase measurements of pain interference more than pain intensity itself. And by that, I mean how much pain interferes with daily life, how much enjoyment do you get of your daily life. And so to me, this is a strong indication that psychedelics have a profound effect on the psychosocial aspects of pain. They do indeed also act on the biological aspects of pain. In healthy volunteers, for example, uh, taking LSD in improved pain thresholds in a study from Maastricht University. But I think what can be life-changing is exactly this improvement in pain interference. For someone experiencing chronic pain, this could mean a change from suicidal ideation to, okay, let's give it a go. Let's give this life a go. Or perhaps even, I will enjoy myself despite feeling pain.
Yeah, I can imagine that that would be really life-changing for someone with chronic pain, especially if they're not responding to conventional therapies.
Mhm.
Um, and I want to talk about your interest in women specifically. So, why is it important to center women in chronic pain research? And what sort of unique challenges do you think women might face that contributes to chronic pain and its burden?
Centering women is very important, first of all, because most chronic pain sufferers are women. In the same way that most people with lived experience of depression and anxiety are women. And we would do a disservice not to study the effects of psychedelics in the population that needs it the most. Um, there are considerations we need to take into account. Women's bodies are different from men's bodies. We're not just a deviation from a standard that is men. And we, for example, for naturally cycling women, we undergo changes in hormones which can influence our mood, our perception, but also how psychedelics interact with our bodies. Since, for example, estrogen influences almost all aspects of serotonin synthesis, signaling, and degradation. However, this doesn't mean necessarily that things are too complicated because they're predictable. We just need to take them into account. Um, Besides biology, there are different psychosocial factors that influence women's lives. So women are more predisposed to mood disorders, which have a high impact on pain perception. Often the conditions are comorbid, so experiencing anxiety, for example, and chronic pain. Um, one psychosocial measure I find really interesting is catastrophizing, which is a form of anxiety when you expect the worst outcome for the future. And catastrophizing is more common in women than in men. Unfortunately, this is one of the reasons why women tend to not be taken as seriously by healthcare professionals, thinking that their pain is exaggerated. However, catastrophizing seems to have a role because it pushes someone to seek help early. And in the case of women, it is thought that they need to do so because they have more complex roles in society. So, for example, women have more caretaking roles. And in order to be able to go where they are needed, they will seek help early, and catastrophizing helps them to do that. There's also social factors, emotional and sexual abuse, both in girls and in women, is associated with the development of chronic pain later in life, and that is not the case for men. They're also more prevalent in women, unfortunately. So women are more vulnerable, more predisposed to chronic pain, and probably the population that will benefit most from an alternative treatment like psychedelics.
Yeah, thank you for explaining that. And you've emphasized that lived experience is a part of your work. So, do you plan to involve women with chronic pain in your future work in this field? We haven't talked a lot about what you're planning yet, but we're going to get there soon. So, what's your perspective on the importance of lived experience?
I think it's very important. It's more important than my own probably biases and plans as a researcher. I think oftentimes we have a plan, we design the measures that we're going to acquire, and we might miss out on important things. So how do we take into account people with lived experience? One way is to do epidemiology. So, for example, um, people out there anonymously post about their experiences online, so gathering data that way. But another way is through interviews. So semi-structured interviews, in which we do our best to listen to and to pick up what we're missing and what might be important. And there are, for example, the Silopane clinical trial from Imperial College London, led by Julia Bornemann and James Close. They included these semi-structured interviews into their clinical trial. They haven't published yet, but I am very excited to find out. And I think that this is something that should be included in every clinical trial, alongside the outcome measures that we defined from the beginning. And by outcome measures in clinical trial lingo, I mean usually questionnaires that will tell us whether the trial has been successful or what contributes to the condition or the treatment of the condition.
Yeah. And I want to turn to your own research now. So, what are you interested in specifically in your research on psychedelics and chronic pain? And what hypotheses are you going to be testing in any upcoming studies?
So I'm interested in women-specific conditions that have to do with our biology. And these are from the chronic pelvic pain category. I would like to focus on a condition that is often overlooked, which is called vulvodynia, and this is vulval pain that lasts for 3 months or longer. It has an immense impact on someone's life and partnership. Women often report feeling shame, feeling guilt, feeling isolated. And there is already information out there of what women with vulvodynia have reported they would need as treatment. And they say they would like to feel empowered, to increase self-efficacy, and to receive a multimodal treatment. By that, I mean tackling all aspects of the condition. And that would be any biological side of things. For example, physiotherapy, so strengthening of certain pelvic muscles or stretching of pelvic muscles, but also receiving therapy. And I am very interested in combining these two. In the chronic pain psychedelic field, there's a lot of talk of how clinical trials should be designed differently than the ones for mood disorders, to include movement, to include breath work, to include the body. And at the moment, I'm not aware of any clinical trials in the works that are doing that, even though I know that there's the desire and the push from everyone to do that. So that's what I would like to test. I would like to test how combining movement with therapy, especially in a group setting, because I'm very mindful of treating the social aspect and building a community in which women would feel safe, and hopefully they would empower each other. How that impacts on this condition, and if psychedelics are necessary for treatment. So I would like to separate participants into two groups. One group would receive this combination, so this multimodal treatment alongside a psychedelic assisted therapy session, whilst the other group would receive only one individual therapy session.
That's so interesting. I love the design that you mentioned there of um, specifying the treatment protocol for the population of interest. So it's not just psilocybin assisted therapy, it's psilocybin treatment and chronic pain treatments or things that might be beneficial to people with chronic pain. So I really love what you're doing with that. And what potential challenges do you foresee in that study? So, like variability in responses or
Mm.
safety concerns with people with chronic pain. Obviously, there's regulatory hurdles, so I'm sure you'll mention something about that. But I would love to know more about your opinion there.
Hmm. So in terms of variability, we know that the menstrual cycle will induce variability. So that is something that we absolutely need to take into account. So that will be perhaps a challenge to dose women at a specific window in their menstrual cycle, um, manage to dose the entire group of women that I'm planning to include in the trial while still keeping them in sync with the other parts of the multimodal treatment. But this is something that is not impossible to overcome, and it is included in my design. At the same time, it's also very important to note the hormonal state for each woman whilst they're, for example, answering questionnaires about their pain perception. Since, especially for women with chronic pain, there seems to be a correlation between pain perception and estrogen decline. So being very mindful of that, taking measurements throughout the menstrual cycle, noting which phase we are in and what correlations we can find. This is one way to think about variability. Um, Otherwise, in terms of psychosocial variability, which is of course very difficult to control, uh, I I I'm excited to do interviews and to figure out maybe what are we missing, who for someone who's responding differently to treatment, will it maybe come up in the interviews that perhaps there was something else going on in their life that we could not account for? For example, we know that partner support influences pain perception. A supportive partner will decrease your perception of pain. Whilst an interesting study showed that if you're living with chronic pain and your partner is insecurely attached, then your pain perception will be higher.
That's really interesting. Yeah, there's a lot of different things, I guess, that you could account for. So it'll be a lot to measure probably, but I'm sure you'll get some interesting results there. Okay, so I want to get into some more general questions now as we get towards the end of the conversation. So, are there any misconceptions about psychedelics and pain treatment that you would like to dispel, particularly for skeptics, maybe in the scientific community?
Yeah, the one I would like to dispel is that psychedelics are a miracle drug,
Mm,
because they are not. Um, I think this is my when I talk to my colleagues about this subject, that's where the skepticism comes from, that this is just another wave of treatment that will solve all our problems. And it's important to note that that is not the case. And seeing it this way is just reflects our bias of having grown up in a Western society with Western medicine of a pill targeting biological mechanisms and fixing the problem. When in fact, even though like we talked about, psychedelics do target biological processes, I think that what makes a huge difference is the work that you as a chronic pain patient do. So the therapy that you do, the support that you get, the integration after.
Okay, yeah, it's a good point. And what excites you most about the potential of psychedelic research for chronic pain in women? And I would also love to know if you have any sort of like milestones that you anticipate in the next few years for advancements in the field.
Um, so I think what excites me most is combining movement with psychedelics at the same time, because at the moment, because of safety regulations that need to be in place, someone who undergoes psychedelic assisted therapy is under a lot of observation, is maybe hooked up to machines, it movement is restricted, and it's also at the moment maybe not considered safe to perform, let's say, yoga whilst you're under a psychedelic. But there is evidence out there from people with lived experience who have benefited from group sessions, in which they took a moderate dose of a psychedelic, um, and then did a movement session together. And I'm excited about this because psychedelics, um, they create a state of openness, and they reduce fear of movement. And this is a big factor for people with chronic pain. They The fear of movement restricts them more and more, which in the end is a vicious cycle because being restricted more keeps you in pain. And then you restrict yourself more. So having the courage to actually move can retrain you that it is safe to move. Um, so when we determine that this is safe, I would love to see these two combined.
Yeah, that would be incredible. It sounds really promising. And
Um,
last question for you. Sorry, did you want to add something to that?
oh, I did want to add as milestones in the hopefully the next decade that will understand more of the interaction between chronic pain, the menstrual cycle, and the menstrual cycle and psychedelics. And I think I'm hoping that we'll also understand more about the cardiovascular effects of long-term use of psychedelics, because I think people with chronic pain might also benefit from dosing protocols with microdoses, but we just don't have enough evidence to say, okay, psychedelics which act through serotonin receptors on the heart, uh, as well as in our brain and the rest of our body, and increase our blood pressure, then if we use this constantly, chronically for a long while, will this impact our health?
Yeah, super important, which not a lot of psychedelic studies do, is include those long-term follow-ups. So I'm very interested as well to see what that shows. And our last question, so for anyone listening that might be dealing with chronic pain or is interested in the field, do you have any advice for exploring psychedelic therapies, and staying informed about your work and other researchers, in this field?
Yeah, I mean, of course, don't do anything illegal. But
Yeah.
if you do have the opportunity to legally explore psychedelic assisted therapy, then my biggest advice would be to give equal importance to the experience as to the intention, setting an intention, preparation, and integration parts. And if you can, follow that session up in the next days, in the next weeks with movement. So either movement at home or physiotherapy tailored to your condition, or very interestingly to massage therapy. And there are massage therapists out there who are trained for psychedelic integration. One of them I've listened to recently, um, who's moved me, is called Suze Vera um, Boros, I think.
Okay.
um, so following it up with movement, relearning how to move, relearning that it is safe, and trying to feel how it feels in your own body. Um, as to staying informed, education is very important because there are indications that simply understanding whilst you're in chronic pain, simply understanding the interplay between pain, thoughts, and emotions already can help you improve your pain perception. I wrote a blog series on how sex differences can impact chronic pain, and also how psychedelics could be used as treatment, which you can find on hystelica.com. I really wanted to mention Hystelica as well because I'm collaborating with Grace Blessed Hopley, who is the founder of the company. It's a company for advocacy, research, education of the safety and efficacy of psychedelics in women. And together with Grace, I've been designing this trial, thinking about what's best to do. I really wanted to mention her and say that I'm very grateful to her. And also, there are two resources that I have no connection with, but I go to often. One of them is the Psychedelics and Pain Association. They are just wonderful. They have a free course on psychedelics and pain online, and they also have the best database of psychedelic treatments for pain. And there is another one called psychedeliclivedexperiences.org, in which, so founded by a trial participant, wanting for voices of trial participants to be heard. And this is, again, for me, a reinforcement that we should include patients' voices. We should include interviews to deepen our research.
Absolutely. Thank you for sharing that, and thank you for all of those resources. That's really a rich array of recommendations. So I'm sure our listeners will appreciate that. And that's all I have. So thanks so much for joining me, Cindy. This was truly a pleasure speaking with you today.
Thanks so much, Elena. I'm so grateful. It's been lovely to talk to you.
Thank you so much for listening to this conversation with Dr. Pop. I'd like to thank the Center for Psychedelics, Health and Research at Queen's University and the support of our sponsors at the Ontario Brain Institute, the Canadian Biomarker Integration Network in Depression, and Providence Care Hospital. Until next time, be well and integrate wisely.